Angelic Health, we focus on providing you time with family and friends, time to celebrate birthdays, anniversaries, and to dance at weddings, and time to love and hold new grandbabies. Hospice care is about your quality of life and respecting your values. Our staff remains by your side, and our services are covered 100% for total peace of mind. Call or visit www.angelic.health for more information. At Angelic Health, we're by your side.
I'm Dan Mikas. I'm the CEO for Angelic Health. We specialize in palliative, hospice, and memory care. We've been in the area for about 6 years now and have expanded throughout South Jersey and Eastern Pennsylvania. We provide services in patients' homes. So we don't have an office per se that's in the where someone would come to. We provide all of our practitioners go to the patients' homes and also nursing homes and assisted living facilities. So hospice is a benefit from Medicare, and some would say that it's probably the best benefit that Medicare offers because it is so comprehensive. It's for patients that are experiencing significant illness, and the official definition is when someone has a prognosis of 6 months or less to live, then they're eligible for the hospice benefit. But we have many patients that have been on hospice for longer than that. And in fact, hospice, when our providers come out and care for patients in their homes, we identify areas that we can actually improve some of the things that are going on. So we manage medications more effectively. We help patients with extra support, with home health aides. We have social workers that are available to get other benefits that the patient may not be aware of and that they may not have access to previously. We have spiritual care, and spiritual care counselors talk a lot about a life review and ask patients questions about, what have they enjoyed in their life and what, help them overcome some of the regrets and process what's happening at the end of life. We also provide massage therapy and music therapy, but all of these services are not just for the patient, but it's for the whole family. And I think of hospice in this way, when we're talking about someone having a baby, let's say, you have 9 months to prepare for the arrival of that baby. And if you were to walk into your doctor's office today and the doctor said, oh, you have 3 weeks, and just surprise, you're pregnant and you have 3 weeks before you're going to have your baby, you'd be in shock and it would be a complete upheaval to your life. And that's why hospice is so important, is because this is going to be a life-altering event. And many people fear the word hospice, but in reality, it's there to give comfort and peace and to help somebody through that process. And the reason why Medicare has established a 6-month time period, and that's not to say that, after 6 months the service stops, but 6 months is a guideline. But they established the 6-month time period because they want people to have the time to talk about what's happening, make those plans for the future, and help your family come to grips with the changes that they're going to see. Most people don't deal with death and dying on a regular basis, so it's really foreign to them, and they may only deal with it in this type of setting, once in their lifetime. But our goal is to make it an exceptional experience. And what I mean by exceptional is that it exceeds the expectations of all the people involved, the patient, the family, the physicians that are involved. We try to make sure that everyone has an experience that they'll remember in a positive way, even through a really, really difficult situation. So you can talk to your doctor about hospice, but I would recommend also to contact us directly. We do a lot of community education about hospice and the hospice benefit, and even before you qualify for hospice, it's beneficial to start talking about that. And that's why we've implemented a palliative care practice as well, because we know that because of the trajectory of the disease process, that at some point you will be eligible for the hospice benefit. But it's important to start talking about it and planning for it ahead of time. It's just like when you have your your car, you're going to need to change the oil in your car at 5,000 miles. So you plan for that and you start paying attention to the signs of what's going on with your car, and then you change the oil when it's time. And planning for your healthcare is the same way. We know that certain diseases, especially, I'll talk about Alzheimer's for a second, but that has a very definitive progression. We know what's going to come next, and we can help families plan for that and get the right resources in place so they're not at a loss. And that's what our palliative medicine program does, is it starts very early in the process. And talking about dementia, starts very early in the process of dementia and educates the family about what's going on and gives them resources to be able to deal with the changing health of their family member and plan out what that family member wanted for their health care. It's our people. I have to say that our staff, our employees, we look for people who are exceptionally compassionate and caring, and people that go out of their way for our patients and their families. Our goal is to provide exceptional care and give an exceptional experience. And a lot of times, organizations will talk about, oh, well, you'll get all these other add-ons. You'll get X number of hours of aids, X number of hours of music, massage. But if you're not taking care of the basics, if you're not showing that care and compassion and listening to the family every time you're there, you can give them all sorts of things, but that doesn't make it better for them. Our goal is to prepare families for what's coming and what may be happening next, and making sure that they have the tools and resources in place so there's no surprises and they're equipped to handle it. We do all of South Jersey. We have 3 offices in New Jersey currently, and from Monmouth County down all the way throughout South Jersey, we provide service. And then in the southeastern part of Pennsylvania, we have an office in Bluebell that provides service to all of the Philadelphia and surrounding counties. And we also have an office in Myrtle Beach, South Carolina, that provides service in the 5 counties around Horry County, which is Myrtle Beach. The best way to reach us is to contact us online. We have our website is www.angelic.health. Go to the contact page, and it has all of our phone numbers for the office that's closest to you. And there's also a form that you can fill out online, and someone will be very responsive and get back to you right away. You can also look us up on Facebook. We do utilize the instant messaging, and we have someone that will respond to you and answer your questions right away.